Hi everyone, welcome to the Jobskin webinar on pleating and the how and the when. With me today is Rosemary Kendall, our clinical advisor from Western Australia, as well as Veronica Eichmann, our clinical advisor from New Zealand. My name's Adam, I'm the managing director of Jobskin, and with that, I guess we'll get started. Today is the presentation a little bit different. Rosemary will do a quick introduction about the topic. We'll then play a video, and then we'll take questions and go through in more detail afterwards. So with that, on to Rosemary.
Thanks for being here, everyone. And I would say that this is one of the questions that Veronica and I get asked. I don't know about the most, but it's right up there. And it's also the sort of issue that comes up from the design team where they receive measurements for pleating in weird and wonderful places, which is not necessarily compatible with how patterns are designed. So we've actually made a video for you, which is on the website under the measuring videos, and you can also access it on YouTube. And so we're going to play that video for you now, but you know that you can refer back to it any time. And then we will answer questions, any questions that might come up. So, right, let's go, Adam. Welcome to the Jobskin video, Pleating, How and When. You may be wondering why we've put this video Sound needs to go up.
Very quiet.
Give me 1 second. Start again.
Welcome to the Jobskin video, Pleating, How and When. You may be wondering why we've put this video together. There's 4 main reasons. Firstly, we want to address the general confusion about what pleating is, when you pleat, where you pleat, and how you pleat. The second reason is to make sure you know how to record a pleat on the forms. Thirdly, we want to improve your general measuring, and ultimately we're wanting to assist you in getting good fitting garments. Let's first look at what pleating is. One of the real pluses of the Jobskin measuring system, apart from the accuracy of measuring a limb circumferentially every almost 4 centimetres, is the fact that all of the length measurements are taken at the same time. You're not having to take separate measurements on the lateral aspect and the medial aspect from shoulder to elbow, elbow to wrist, or hip to knee, knee to ankle. It's all in the one requirement that the paper tape has. But what the pleat actually is when the spine of the paper tape, that's the bit that goes along the limb, is folded at the end to adjust the length, because not everybody's limb is easily divisible into 4 centimetres, so sometimes we just need to tweak the length. Each paper tape, the circumferential one, is 3.8 centimetres apart, just under 4 centimetres obviously. But when the spine of the limb paper tape is folded, that space between the circumferential tapes is reduced. That's how we adjust for the alternative length on the limb. So when do you pleat? Well, as I've said, the paper tapes are the primary indicator for garment length for the limbs. But if a limb doesn't exactly fit the placement of the paper tapes, that's when you pleat. You can see on this photo here that the very top tape, if that was wrapped circumferentially, it's obviously going to be above the axilla, so it won't be able to be done perpendicular. It will be on a crazy angle. And we actually want it to mimic the very top of the garment. So where do you pleat? This is probably the most important thing I'm going to say on the video, and that is you only pleat a tape at either the distal end or the proximal end. There is absolutely no need to pleat anywhere else along the spine tape. But I know some of you feel confused by some scenarios. The first thing is when there's a significant contracture. Now, there's a limit as to how much we could make a mannequin's arm contracted, but you can see that in this mannequin here, the limb is not absolutely straight, the upper limb. So what we find people often do is, in an effort to try and keep the tapes perpendicular when they're wrapped circumferentially, is that they're kind of the spine tape is crumpled up so that the tapes are pleated around that contracture, so to speak. That is not required. You just continue to have the circumferential tape crossing the spine tape at right angles. It will be fine. It doesn't matter that it fans out a bit, as you can see, proximal to and distal to the elbow in relation to that elbow tape. The second scenario is, what about when there's marked changes in circumference in the limb? Now, this is quite tricky to show on a video, so we're using just like a graphic here, and you can see the kind of the mauvey boxes here, they're simulating the tape wrapping around a limb. And you can see, to start with, that they start perpendicular to the outline of the limb, but as the limb, that curve goes down, in order to keep it wrapping nicely, you can see that this is simulated as being caught on an angle, and that's not going to give you a good measurement. So some people think, well, maybe if I just bunch the tapes up together, i.e. put in extra pleats, that will solve that problem. But in fact, you don't need to do that. You continue to keep that same 3.8 centimetre gap, but if you look at that very last mauve box there, you can see that it's sitting a little bit below the limb shape on the left-hand side and a little bit above on the right-hand side. So don't be tempted to tilt the angle of the tape. Just continue to wrap, trying to keep the tapes lined up together, and you will find that there is no need to pleat. Now, there is one possible exception where you might pleat along the spine, and that is if you are wrapping paper tapes around a component of external fixation. I apologise, that is incorrect on the slide. If you've got sort of screws in the way, then obviously you will need to make an adjustment. However, if you do that, please take a photo while the paper tape is still in situ, so that the designers can see how those pleats relate specifically to the external fixator. Now, how do you pleat? It's actually very simple. Don't overthink it. You just slide the circumferential tape to where you want it to wrap the limb. So if we use that photo that you can see there, you just take that last tape that is unwrapped and you just slide it down the limb a bit, so you can see that the spine of the tape will buckle. You can see that happening there, and then you fold that buckling of the spine paper tape so that the circumferential tape sits just where you want it to sit. You crease that fold so that you're securing it flat, so to speak. Then you wrap the circumferential tape and secure it just as you would any other tape. And then you secure the folded pleat. I usually use a little bit of sticky tape. But now, how do you record that? So if you have a look where that pink or red arrow is, that is the 3.8 centimetre gap between the tapes as it is standardly. However, the tape on the left is obviously a lot closer to the middle tape than the tape on the right. So we need to have a way of communicating to the designers how much closer those two tapes are. That little distance there between the two lines of the circumferential tapes, that's the distance we need to indicate. So you use another measure. You can use the endy bit of one of the circumferential tapes, or you can take your retractable tape measure and you measure from the central line of one tape to the central line of the next tape. You can see that there. If I use a paper tape, my little cheap way of doing that is I use a 0, so like 20 or 30, so that I can easily calculate the difference so that I don't make any mistakes. And then how do you record that on the form? This is an arm form here, and you can see there is a pleat box at the top of the list of circumferential measures and a pleat box at the bottom. If you pleat at the distal end, you'll use the top box. If you pleat at the proximal end, you'll use the bottom box, and that's obviously in relation to the numbers of the tapes that you can see there on that list. If you pleat at both ends, then you use both boxes. So you make the choice about where you need to enter it. You can see on that middle column there that there's been a measurement entered in the distal one. It says 18 there. Or in this case, there's also been a pleat made at the proximal end, and 17 is written there. And that's it. That's all we need to let you know about pleating. As always, if you have any queries, then you can let us know.
Cool. I'll stop sharing that for now, so hopefully I'm back. But as Rosemary said, this is one of the most common questions we do get as a team, both from a clinical and a design perspective. So if you have any other questions and things like that, feel free to open it up now to Rosemary and Veronica.
I do hope we didn't complicate it. It sort of seems like it's something so simple, and when you try to distill it down into a kind of succinct way of, it suddenly seems a whole lot more complicated for what's a very simple process. But if you have any questions, then fire away by all means. Thank you, Brenda. Brenda's just said that was very clear.
Yeah. Or if there are any examples clinically that we can point out around, what we've done around pleating, how it's useful, or things like that as well, that we can potentially add to the video.
I think probably one of the things, we did say this in the video, but it's where you have fixed contractures, which might be burn scar related, but there's also, we all know that there's multiple reasons you can have limited range in a limb. But the way that the Jobskin design system works is that it references the spine, and so if the tape fans, like the circumferential tapes, if they fan a bit, like if you've got a contracture, if I stand like this, and one tape's like this, but the next one sort of seems like it's going out like this, don't stress about the fact that at the other side of the the back side of the tape, that it's not staying 4 centimeters apart. That doesn't matter. We just then, if you have that kind of scenario, you let the designers know how much that contracture is, and then it all kind of works itself out from there. So I think sometimes this is the bit about not overthinking it, because we sometimes stress about the fact that it just doesn't look right. It doesn't look like a normal limb, but if you can show the degree of limited range of motion and just let the tapes do their work, so to speak. I'd say that's probably the scenario that is the most challenging for people, because just shortening either end is usually, we can work that out. But it's when the tapes don't seem to do what we think they should be doing.
Yeah. Alex, I think, has a question. She raised up her hand.
Hi, Rosemary.
Hi, Alex.
I've just got in mind a lady who had a big flap to her forearm after a motor vehicle accident, and her arm went from quite a normal wrist to less than the 3.8 centimeters up to a very, very voluminous kind of arm. So I ended up I just did the normal pleat at the distal end, and then halfway between that, well, between the next measurement and I think a couple of measurements up between the 3.8, I took another measurement just with my measuring tape, and I recorded it all on a photo, just because it was just such a vast difference. Is that all right?
Yeah, that's a great idea. And
Okay.
because then I sometimes say to people, and I'm sure Veronica says the same thing, that for the designers, we are expecting a list of numbers to tell them everything about the patient that they need to know. And sometimes when you have, I say this without any disrespect, when you have like a weird and wonderful shape, you just go, those numbers that they won't and can't get it. And sometimes if you provide additional measurements, sort of like in the comments section, then they can take or use them as they wish.
Yeah.
But like when you do that by adding in all the little pleats, which you haven't done there, then it confuses the system. Whereas sometimes we really do need to say, actually, you're not going to be able to see what I see. And so, of course, photos help.
Yeah.
And but when you have such a sharp change in circumference like that, I think taking an extra measure, and even if you can take a photo, tape in, circumferential tape in place, and then where you're putting the extra measurement, it all helps. So yeah, I think that's a really awesome idea.
Thanks, Rosemary. Yeah.
Cool. Brenda also had a question. She said that she's been using Glad Wrap to wrap the pendulous upper arms, where there is a large jump in arm circumference. Is that Glad Wrap process still okay?
Absolutely, absolutely. And it might be that you can use like a bit of Tubi, the shaped bandage, or Tubi Fast, or whatever you can use to stimulate how the tissue is going to sit in a garment. I think that's a really good question, Brenda, because Jobskin uses body measures rather than sculpted measures, like when you're measuring for a flat neck garment, the more that we can make the tissue sit how we want it to sit in the garment, the better the measurement that we'll get.
All right. Are there any other questions or tips or cases that you'd like to bring up around pleating and how and when? All right.
Nope.
So yeah, that was a bit of a short and sweet webinar. We wanted to reach out and provide the opportunity to go through one of our most common questions. So thank you very much for joining us today and then bring out all the questions that you had. If there's anything else, as always, please feel free to contact us, Veronica, Rosemary, or myself, and we'll do our best to help. With that, we'll give you guys back the rest of the day, and then we'll go from there. We look forward to seeing you on the next webinar. Until then, take care. Thank you.
Nice to see you, everyone. Thanks. Bye.
Bye.